to Mobility Agility Chiropractic Performance. Today we're joined by Josh, who sustained a low back injury while shoveling. Why don't you tell us about that?
Yeah, so it would have been the winter of 2008. Wasn't really keeping up on my front porch, so I took the shovel out, was trying to clean it off, had some ice had built up on the steps, and I slipped. And I always tell this story, it's like in the movies when the feet go up in the air in slow motion, and all of my weight came down right on the edge of a step, right in my lower back.
So we have this mechanism of injury. This is a very common one this time of year, especially in the Midwest. So it's important after a fall to take a minute and assess what happened to you. Don't immediately try to stand up. Take a deep breath and relax and see what actually hurts. This can really be a challenge since our first instinct is to immediately jump up due to embarrassment. But as we get older, we don't bounce. Now, the possibilities of the injuries include bruising, which would be a no big deal, to a possible fracture or even a disc herniation. The location of the pain, the type of pain can help determine what the issue is and who you should see. Now, there is something that you have to go to the emergency room right away, and that's for a syndrome called Caudy-Equina syndrome. This is where the nerve bundles right at the base of the spine get compressed and injured, and this leads to a true emergency. It causes low back pain, referral typically down both sides of the legs, and numbness and tingling in a U-shaped saddle positioning around the groin and anus. This numbness and tingling then leads to bowel and bladder dysfunction, which can become permanent if not appropriately treated. So if you ever have an injury that leads to those types of symptoms, go to the ER right now. But that's not what happened in this case. So let's see what happened to Josh. So you slammed your back onto a step. What type of symptoms occurred after that led you to seek help?
Yeah, so immediately nothing. But I hit hard and I just kept asking myself, I had to have messed something up. So I'm a pretty avid skier. I play a lot of basketball, so I continued to do those things. And as time went on, I just started to get this pain down my left leg that simply got worse and worse and worse.
So what Josh is describing is radiating pain. This is pain that starts from a central location, typically in the middle of the spine, and then extends down the legs. Or it can occur in the arms if you have an injury in the neck. The most common one we think of in the low back is sciatica. And this pain typically affects the low back, the hip, and the outside of the leg. And this is caused by compression of the spinal nerve roots, which come out and are the yellow little plastic nubbins here, and get compressed. And this typically is caused by degenerative changes, but can be caused by an acute injury and by muscle spasms. It's important to see a healthcare provider to determine the exact cause of your radiating pain, because it can be from something really simple to something much more complicated. And you really need to determine which one so you have the appropriate care so that it doesn't go on for too long. But how long can it take after an injury for those symptoms to come up? How long did it take for that pain to go down the leg? Like, how many weeks, days did it take for it to really get down there?
I believe the fall was in January, and the pain, I mean, again, this was over a decade ago, but probably 2 months.
Okay.
Plus it started and then worked itself up through the spring.
Okay. As you can see, this is one of the complicated things with low back injuries. It sometimes takes time for our body to show the true extent of our injury. Are there potentially ways to prevent the progression? Maybe. Seeing a chiropractor or physical therapist right away after an injury can help start the healing process with the right rehab exercises and mobility work. And this really can help potentially prevent the progression of an injury. Now let's see what Josh decided to do. So as the leg pain progressed down the leg, who did you go see? What did they do? Did they send you to someone else?
Yeah, the first stop would have been to my family doctor. I think he recognized the symptoms for what they were and then he referred me to, through a combination of the insurance wanting me to go through a process of physical therapy and then beyond, and then also a back surgeon as well in time.
Your general practice doctor is a great place to start because they know you. But it's important to know what the research is showing so that you make an informed decision. So, excluding symptoms of Cauda-Equina syndrome, trying a course of conservative care from a chiropractor or a physical therapist before imaging is an important first step. Now, this is based on your history, and it may be important to get the images first. But that is for you and your provider to decide. Research has shown that x-rays and MRIs are not predictive of pain, meaning that just because there is a disc herniation or degenerative disc disease on the image does not mean that they're causing your pain. But when you hear them, they really make everything worse because it makes you feel debilitated. Now, that's a recent change. We're trying to clean up our language. 10 years ago, as Josh was going through the system, they went straight to an MRI. And here's what they found. So what diagnostic tests did they do? What were you diagnosed with? So what kind of happened after seeing all those providers?
Yeah, so it was, the jumping off point would be the MRI. It definitely showed a bulging disc.
Now, the bulging disc was found at the level of L5 and S1, and it was compressing the nerve root right through there. And this was causing the shooting pain down the leg. Now, the funny thing is there was an additional finding beyond just the disc bulge, was that Josh had a normal variation in his spine where L5 had an enlarged transverse process trying to be a sacrum. So it's called sacralization. This is completely normal, but it does change the biomechanics of the low back and potentially predisposed him to having this disc bulge that the injury just aggravated and caused all the pain.
Beyond that, physical therapy was required by my insurance company, so I went and did that for a month or so. I had great results right immediately after I left, but the pain usually shortly returned beyond that. After that, there was, I believe, a steroid block injections that were done. For me, they never improved anything. It only made it worse. So at that point, we had stopped and elected to proceed with surgery.
So Josh went through the conservative pathway of physical therapy. At the time of his injury, I was still a student, and this provided him limited relief, which led to the progression of needing steroid injections. This is something to make sure prior to receiving for any joint in your body, you understand some of the side effects and have had a good conversation with the doctor. Cortisone or steroid injections anywhere increases degeneration and can affect blood sugars if you're diabetic, which then affects healing. And there's no guarantee that they'll help. This is why after a month, they elected to do surgery. So you started off with physical therapy, didn't get a lot of relief, tried some steroid injections, and ultimately ended up having surgery. How did that go?
Surgery went well. Immediately after I came out, although I was sore from the surgery, pain down the leg was very minimal, so I could tell right away. As time went on, I went back to doing pretty much everything that I was doing before, and occasionally they refer to it, I guess, as phantom pain. I get a little twinge, but it's always been there, and it doesn't really keep me from doing anything.
And then, have you had any other episodes of low back pain or recurrences since having the surgery that were significant?
Yes, in September of 2018, I had another flare-up that caused me pretty significant pain down my leg, reminiscent of 10 years prior, which scared me from the standpoint that I know what road I had in front of me back then, in retrospect. So doctors thought it would relieve itself on its own if I took care of it. So I've been going to the gym and working on it from that standpoint to strengthen my muscles.
And has that helped?
So far, it has helped immensely. I really kind of started my regimen in July of 2019, roughly 3 days a week, working with the trainer to strengthen, of course, the core muscles, the back, the legs, things like that. And I'm back to doing what I was doing before.
Now, this is an important piece. Instead of throwing him back into surgery, the doctors encouraged him to move. Low back pain can be caused by poor core stability. Think of your core like an internal weight belt that's wrapped around you. If it can't stabilize you through movements, the low back muscles are forced to compensate, and this can cause muscle spasms. These spasms can compress the nerves and shoot pain down the leg. And for what exercises you can do, I've already made a video. So I'm going to link that below so you'll be able to check it out.
Throughout the past 10 years, I've had a lot of support chiropractically. Prior to me re-injuring last year in 2008, it was a monthly occurrence, maybe twice a month, that I'd go see a chiropractor because I knew that the stiffness in my back would lead to spasms, things of that nature. Since I have been going to the gym and working with the trainer to strengthen my back, I think in 6 months I've been to the chiropractor maybe twice, and I don't even know that they were necessary. It was more just me being, taking the precaution.
And this is why at Mobility Agility Chiropractic Performance, we provide everyone with a treatment plan that has exercises because we want to give you control of your body. We don't want you to be reliant on us because we want you to be empowered. So thanks for watching this video. We hope that you subscribe to the channel. And remember, we want to get you better faster, keep you better longer, because no one has time to be sidelined. To keep up to date with future content, please click subscribe. Additional information is found in the description of this video.
All information, content, and material of this video is for information purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider.